Great. So, hello everyone and welcome. Liat here from Hyro. I'm thrilled to be your session host. Thanks for joining us. And for those who are with us the entire day, thank you for embarking on this day full of wisdom and learning and thought leadership. We hope you've enjoyed it. We saved the best for last, to be honest. Our speakers today are Joel Vanko, SVP and Chief Information and Digital Officer at Hartford HealthCare, and Barbara Casey, President of Consulting Services at Pixel Health. They will present digital front door strategies for 2025 and beyond, leaving us with plenty of food for thought for the future of healthcare and the digital front door. So, Barbara, thanks for being here. Joel, it's great to see you. Barbara, mic is yours.
Great. Thank you so much, Liat. And thank you for having both Joel and I here. Super excited to be here and humbled and honored. So um, let me just start by kicking it off a little bit, and then I'll get into it with Joel. So, pressures for health systems to evolve to that consumer-centric model and in the intentional service model are immense. We all know as consumers in the market from other industries that we can do so many different things just by from anywhere using our smartphone, like paying bills or making reservations or watching movies or what have you. And so our expectations about healthcare are really the same, right? We are hoping to get that kind of self-service and digital support that easily. And that's a challenge. So how do we get there? So I'm super excited to talk about this with Joel, who's not only an industry leader, he's also my friend. He's, as you heard from Liat, he's the Chief Information and Digital Officer at Hartford HealthCare. He and I have worked together really in the pursuit of this digital personalized consumer and patient-centric service model the last several years. In that time, we've had a lot of discussions about digital front door, but not only the front door, right, Joel, the side door, the window, the back door, lots of different entry points in the health system for patients to be seen and to have access. I know that you and your team work very hard every day to prioritize and invest in many of the components that lead to greater digital proficiency and access. Let's dive in and talk about some of those. So first, let's orient everybody to Hartford HealthCare a little bit. Tell them about your system.
Sure. So good afternoon, everybody. Barbara, it's great to be on with you. And Liat, thank you so much for having us. So yeah, Hartford HealthCare is the largest healthcare institution, healthcare system in Connecticut, so Northeast. And we're based in the heart of Connecticut in Hartford. And then we've got 8 hospitals across the state, but we've got over 500 sites across the state of Connecticut. Roughly 6,000 providers or clinicians, and we've got about 7,000 nurses in our health system. When we've got a number of access points, including ambulatory surgical centers, 8 institutes, and this past year we were awarded 8 A's by Leapfrog. So we love to talk about how we're the safest and highest quality healthcare system in the country, or one of them. There are very few that got straight A's this past year. And we also are, very fortunate enough to have a number of universities surrounding us. And so we've got medical students and a lot of academicians who go through our health system. So, happy to be here and really excited to chat with you, Barb, about some of the challenges and the successes, and also some of the futures of digital front door. So great to be here.
Yeah. So I know that you guys are, I consider you, I think about all my clients, and I consider Hartford HealthCare to be extremely innovative as it relates to your strategy and how you go after partnerships in the market, how you have so many geographic access points out there across the state. And not only are these physical access points, but you've developed a lot of digital and self-service and virtual type connections with some of these as well. Can you share some of that strategy and plan around how you really create multiple access points for patients and give them lots of variety?
Yeah, sure. I mean, for us, it really is about access. I know that is for all other health systems. I mean, access is the largest challenge that we all have, aside from some other things like making margin. But access for our patients is probably the largest issue for us to solve. And for Hartford HealthCare, we have an equation that we go by that includes access, and we call it A2E2, which is access, affordability, equity, and excellence. And so those four make up, our vision and hope for healthcare writ large. But that really drives the way that we have thought about and architected, our health system. And so these partnerships, become front doors for
Mhm.
our patients. So we are looking to create as many access points as possible so that we can achieve that A2E2 vision. And part of this too is that we also see a lot of folks outside of this industry coming into healthcare, and we've seen a number of them: Walgreens, Walmart, Amazon. And rather than fearing these competitors, we are looking to partner with them in different ways, and mostly focused on continuing to keep our patients and making sure that their care is continuous across the larger continuum of care. And so, our partnerships include, for example, Go Health. I know a number of folks have have partnerships with Go Health. We have over 54 Go Health clinics across the state of Connecticut, and that partnership just continues to flourish and grow. That's an urgent care level of care for our patients. We have a partnership with Amazon, and which was once called One Medical, and it's really at some level more of like a subscription based, maybe call it concierge medicine or membership based medicine for primary care for some of the employees down in the southern part of Connecticut. We've experimented with other kind of partners that include like OnMed, where it's sort of like a phone booth that you go into, and there's nothing in there except for a big TV screen and a bunch of peripherals that you can use to help the clinician on the other side, do things like measure your weight or take your blood pressure or look into your ear, et cetera. And then we've had some other partnerships like with Walgreens, where we're focusing on same day care. It's a little bit lower acuity than urgent care, but it's same day care with a virtual component capability to it. Those are some of the sort of the partnerships that we've created. We've also created partnerships with universities, as I mentioned, like Quinnipiac. We do health services, sort of capabilities for students there. We've also partnered up with Pennant Health, who is a large home health vendor, and we are the largest home health provider in Connecticut. And so the two of us are coming together to really create this larger home health capability that enables us to take on even better technology that we can offer, and certainly operations that we can offer to improve our our overall care for those types of patients. But these are some of the areas that we've been focusing on to ensure that we've got access points that are accessible and equitable and excellent for for our patients.
Yeah, that's fantastic, Joel. I really appreciate you sharing all of those. I think it really speaks to just the really broad nature of your organization when it comes to access. And I know that you have a digital and data future in mind, a different reality than you're at today. Let's talk a little bit about some of the fundamentals that you and your team are driving for your data and digital platform.
Yeah. So, our vision at Hartford HealthCare is to be the most trusted and personalized and coordinated care. And to me, it's such a profound vision, because it allows us, particularly in information technology services, to be able to really focus on a goal that we know has to be supported by technology, and most specifically data and digital. I mean, to personalize something, you have to have information about the consumer or the user. You have to know them, and so that requires data. And I think part of the challenge that we have in healthcare is we often don't have enough of the resources and the capabilities to harness data. And certainly our core systems aren't enough. They're great core systems to do the things that they need to do for for clinical documentation or lab management. But in aggregate, it's really hard to bring those things together so that we can leverage them and harness them for personalization, if you will. And that's why you've got these large organizations like the Amazons of the world, and even organizations like Netflix, who are able to harness that data to be able to personalize engagement. So that's one of the things that we need to be doing, is making sure that we're personalizing our engagement with our patients. And the other part is coordinating care. And how do you coordinate care, especially when you're like us and many other health systems? You've got all of these capabilities, services that you can be providing folks, but the biggest challenge that patients have outside of access is, if they do have access, they don't know where to start.
Yeah.
And so you need to be able to coordinate for them, even just the first door to go through, and then the subsequent doors thereafter. Healthcare is complex. It's difficult. It's unique to every patient and person. And so that's really the challenge that we've been focusing on, is how do we achieve that vision of personalized coordinated care? And so with that said, the focus first and foremost is to have a fundamental and foundational data platform. And so we've been developing it over the last year and a half, first starting with moving much of our workloads to the cloud. We've got 10 data centers. Don't ask me why, but we've got 10 data centers, and we've reduced that now to 7. We're going to continue to do that over time, and really move a lot of that to the cloud, so then we can be more agile in moving the data into this receptacle, this data platform that we call the Hartford HealthCare Data and Digital Platform, or H2D2. I just realized that I love these equations, right? But anyway, so that's more of an homage to Star Wars, to be honest. But H2D2 is our platform for data, and that's really I think a fundamental capability and platform that all health systems have to have before they even get into digital. When we started seeing a lot of this advanced analytic capability and AI capability, like, you can't get into that stuff without good data, and certainly not without a data platform. So a platform like H2D2 is definitely critical, and that's really where we're starting. And then from there, it's really about developing a platform that creates or enables what I call data liquidity. And data liquidity is really being able to move data from anywhere in your environment, particularly in your infrastructure environment, and serving it up in ways that are easy and seamless and custom to the consumer of that data, whether it's an analytic report, or it's an AI engine, or it's some sort of third party that needs it for decision trees or whatever else that it's going to be doing for you. But that's a fundamental issue that we have today, is that data liquidity doesn't necessarily exist seamlessly. APIs are here now, and we can start to leverage those, or standard APIs, and those are all good. But we also have to create that layer ourselves at some level, and enable these partners to be able to consume data. And by the way, at the end of the day, patients in the future are going to want to have the access to that data, and it's not just going to be through my chart account, or some of the ways that we serve them today. It's going to be a lot more sophisticated. So I think having that data platform is going to be hopefully future proofing. But that's sort of what we're doing to kind of prepare for that digital future. And I think if you can, again, harness and capture and create a platform that holds your data in a way that you can control it, then I think the digital future really is at your fingertips. And I'll just end by saying that the other part of this too, and it's not easy, and we've sort of seen it in our journey over the past year and a half, is you have to have folks who know how to do this work. You have to
Yeah.
have cloud engineers. You have to have data engineers. You have to have data scientists, and
And that's different, right, than what you have today. Your workforce has to evolve too.
yeah, your workforce has to evolve too. That's a fundamental, just a foundational requirement, and it's not easy to find those folks, nor is it easy to train the people that you have in house, because they all have day jobs. They do things every day, and it's hard for them to extract themselves to get some of this new learning. But that's the challenge, I think, and yet that's what we have to get done to be able to get to this digital future is to really harness your data. So.
That's great, Joel. Let's make it practical for folks. How are you applying it? I know, for example, that you've done a lot of work to really make. We all have doctor's appointments. How do we make those doctor's appointments fully digital, fully paperless? How do we do that? How did you do that with your medical group?
Well, it's funny. I think the dirty little secret that we all have is that we're not all paperless, right? As much as my institution, before I got there, they went ahead and I think they did the right thing. They digitized the electronic health record just like everybody else did. We implemented. I don't know if I can say the word, but Epic, right? Epic. Everybody else has done Epic or Cerner, one of the two. So we did Epic, and we digitized the record. And why I say the dirty little secret is that we're not paperless is because everybody assumed that from there'll be no more faxing and there'd be no more this and that. But I had this one experience with my CFO. We were at going into a leadership meeting, and I walk in, and the president of our medical group walks in, and our CFO goes, "Hey, you two," and he's literally across the room. He's like, "Hey, you two, get over here." And so we're walking over like two little teenagers because I don't know, when somebody says, "Hey, you two," you feel like you're all of a sudden in trouble. So we walk over there, and he brings over a stack of paper, and he goes, "I have my PCP appointment tomorrow, and look what I have to fill out." And I'm like looking at him, and I go, I just went to my PCP appointment, and I used my chart or whatever it is, and I filled out most of the forms. I mean, it was long, and
Yeah.
I don't think it was complete, but I certainly was able to do it. And so, that moment, that was last year, we decided to embark on this whole initiative that we called, the visit starts at home and the paperless office. And so, and the intention was to truly get it completely digitized. And only in some, extraordinary cases would we, give a patient or a provider any kind of paper
Yeah.
to dole out. But in partnership with our providers, we absolutely focused on designing a process where patients, even those that are the most difficult and technologically lacking, if you will, we made ways or created pathways for them to be able to fill out forms, at sort of the front end, and then continue that process of sort of digital check-in, digital scheduling if they wish to, and then everything from the after visit summary to be digital to billing to all of the other things that you would want and need as a patient, and stop printing paper, because only very few patients really at the end of the day wanted any kind of paper. We found out. It also helped our office staff, our physicians and clinicians, and the clinical office staff, obviously to use less paper, check in folks manually. It was all automated, and our current EHR did most of it. We had to fill in some of the gaps, but it was mostly done through our current systems and/or some level of augmentation with other technologies. But that end-to-end process, to your point earlier, it just is just an expectation now. Anyway, it's like going to the airport. Unless you're, dropping off a bag, you really want to just go to the kiosk and get it over with, and then get on the plane. So that's basically what we are doing now. And admittedly, we're still continuing that sort of rollout, but most of it is now fully digital, which is great. So,
Which is awesome. Um, and so when you think about patients and their experience, how do you really help them feel connected to Hartford HealthCare? How do you make them feel like they belong and they are members? And I've heard you talk a lot about that. I know you have a vision around it. Maybe even share what you might be wanting to do with AI in that particular regard.
yeah, I mean, I sort of spoke about the visit starting at home, and that's a part of this larger strategy of leveraging digital to connect with our patients. But one of the things that I've wanted to do since I got to Hartford Healthcare was really disrupt this idea of a person being only part of a health system when they're a patient or when they're sick, if that makes sense, right? So, I think we need to get beyond that notion of, a person like me only being a member of Hartford Hospital or whatever hospital we've got when I'm sick. We got to figure out a way to make the person feel like they're a member of the community, and that's really sort of the challenge that me and the president of our medical group decided to sort of make to our colleagues, is to say, how do we create this feeling of belonging and community of people in our state, for example, so that they feel like they're a member of Hartford HealthCare. So it's rather than being a place where they go when they're sick, it's really a place. It's really a sort of a community that helps them be healthy and viable.
All the
Over
time.
all the time. Yeah, all the time. And so, so we took sort of inspiration from other, organizations in other industries, and how they see customers as members, not as, a thing you're doing something to, right? And so that's really the thesis that we have, is how do we make them feel like they're a part of us? And so this notion of creating membership, providing them with maybe a welcome package at the very beginning, and there may be in that welcome package ways that they would engage with us, and it could be, a set of applications that they might want to consider, or even something that allows them to be more connected to us more continuously, or like we're thinking about things like, how do we become more habitual in their lives, right? So devices that are kind of bespoke, like an Alexa, is something that, we're kind of considering, how that can be a persistent part of somebody's experience throughout their life, and your health system could be there when they need you, or you can provide them with advisement, reminders. We've got these ideas where, I mean, just like Alexa, it's so intrusive, and it's not private, right? And yet you trust it being in your kitchen. And so, we're thinking that since we're the most trusted in the community, why not have a persistent device in the home of a patient potentially, right? And so we're thinking about ways like that, where we can engage with these patients continuously, and they can have us at their fingertips, literally, when they need us. And we're actually experimenting with AI, generative AI, in that manner, where instead of a live agent, you're using AI, and that AI bot or agent could be on that bespoke device. And so that's kind of how we're thinking about a different type of digital front door, or different type of engagement. Is, this is yet another channel, but it's a persistent channel, or
And on
connection.
demand, something more on demand for patients to call upon.
That's right, on demand, but also it may actually, flash a little bit of a red light and say, hey, you've got an appointment tomorrow, make sure you go to it. Or listen,
Predictive.
yeah,
Yeah.
listen, you're about to miss your appointment, you better get on the road. We haven't seen you brush your teeth yet. So, that kind of thing. But
Well,
so
you're talking about AI, and I'm sure, I know today there's been a lot of discussion about responsible AI. And so how would you share how Hartford Healthcare is doing its best to really make leveraging AI safe and reliable, while you navigate this emerging technology and capability?
yeah, I mean, for us, we've really we really established our governance process as early as we possibly could, or at least the thinking behind it. I mean, I wouldn't say that it's perfect, but it's pretty good for a first shot. And it's a multidisciplinary body, that it really is kind of the backstop, or the first toll gate, rather, for considering the use of any kind of AI. And it may sound bureaucratic at some level, but right now it's the best way for us to be able to know what everyone is thinking about doing, and what they're using with regards to AI, Gen AI specifically, because I think that's the most that one's the most precarious in many ways, or the thing that most people are worried about. But the body itself is really focused on risk, and what's the risk versus reward. And so if it's a little bit more administrative use in nature, it may go through that committee pretty darn quickly. But if it's clinical in nature, then there's a lot of focus on discussing what is it really trying to do, and how does it impact patients or providers and diagnosticians, et cetera. So it's I think a very good first step towards really making sure ultimately that the risk is as low as it possibly can, because we don't want to stifle the use of AI,
Mhm.
and certainly we don't want to stifle experimentation and innovation, but we need to make sure that we have a good pulse on what's going on and who's using what, and how to advise our colleagues on how to use it without putting the organization or patients at risk. So one example I'll give you is I think many organizations now are going through the new year for benefits, right? And so we put together a Gen AI bot or agent that consumed all of the data from our from our benefits like package.
HR, yeah.
And so you can ask it things like, what are the benefits this year compared to last year? What's the difference? So how much is my copay? What if I got a med that's not on the formulary? Do I get a gym membership for free? Those kinds of questions. What I come to find is that while I thought it was sort of low risk, there's some merit to people's sort of apprehension of using such a
Yeah.
bot so early to provide advisement on benefits, on choosing benefits. So while I was a little kind of surprised, I understand this stuff is early still, even in things that we think are less risky. There's reason to slow down and take a pause and try to understand what could we do better or differently, and make sure that we're not putting people at risk, decisions at risk, et cetera. So a lot more to do there, but I do think it's going to be the way of the future for sure.
Oh, absolutely. Um, well, I know we've talked a lot about patients and their experience and access journey. What When you think about the providers and their experience, because we both know when you have an encounter, it's a shared experience, right? It's not just the patients, it's also the doctor or the APP. Um, how would you balance the digital work that's got to be done, you know, um, to take into account the provider's experience while you're so intently designing for the patient?
Yeah. Well, I mean, it's two sides of the same coin, right? And so you design a digital front door or a digital capability. You have to make sure that you're kind of aware. You're aware of both sides of the equation, the consumer and the provider, if you will. And you know so we don't want to create inadvertently a mess for one side because we're trying to optimize the other side. And so part of this is thinking about it from a design thinking perspective, if you will. And in thinking about that, we believe that some of the questions that we should ask are, is it truly desirable, right? First and foremost, so in other words, what really makes sense for people from a functional perspective and a solution perspective? Is it feasible? Can you really make it happen? Is it possible to actually make happen today and maybe even in the near future? And then what's the viability of it? Once you get it done, can it be sustained? And so you got to think about those things for both sides of the equation. And I think there are often times where we do stop sort of the development of let's say a digital capability because it's just not feasible or accessible or addressable by one side of that equation. And so our partnership with our clinician community, as well as our patients, and the way that we do some level of market testing, really gives us a sense of how to balance those two sides. But it is a balance, to your point. You don't want to just cater to the clinicians necessarily, because it, I think, sacrifices the experience of the patients And then of course, if you give everything to the patient, it sacrifices the side of the clinician's work as well. So it's definitely a balance, and the choices are made when that balance is equitable for both.
Yeah, I love that you shared that you value human-centered design. We do as well, and that's probably why we work together well, because we like to start with that as a construct at Pixel Health. Um, what kinds of emerging technologies do you believe will have the most impact on the next decade? Let's say we want to talk about the future. What do you
Yeah.
see in the future for our industry?
Um, well, there's so many things that are really interesting right now, obviously, and I think suffice it to say, I'm sure we a lot of folks talked about it today. I mean, AI is certainly one of the tops that are going to be, just it's going to be integrated into healthcare. It's going to be synonymous with healthcare at some level. I definitely see it as being, sort of a co-pilot or an assistant for clinicians and patients alike. I mean, a lot of healthcare in many ways is searching for an answer. And so, whether you're a patient or you're a researcher or provider, and I think the velocity which we can, kind of accelerate those searches, and even more intelligent searches, is certainly something that the advanced analytic capabilities like AI and ML is really something that I believe is going to be. It's just going to evolve rapidly. And in the last year and a half that Gen AI really hit the mainstream, it's evolved even pretty rapidly. I do think that mixed reality is something that I'm looking forward to seeing more of. That includes
You
like
mean like
immersive,
augmented reality or virtual reality
augmented,
or
exactly, augmented, immersive, virtual. I mean, there's so many things that can be that you can see that will help in healthcare alone. I mean, not just medical education,
Mhm.
um, but also therapy. Behavioral therapy, pain mitigation. You could even see it from a customer service perspective, where as we were talking about that sort of package that we might send to a patient. I mean, getting folks accustomed to a facility that they're going to be in for a little bit. Maybe as post discharge patient or something like that. Because oftentimes you don't, as a patient, you're not really sure what the facility looks like. You're kind of afraid that it's going to be, something that you're not going to be happy with, and oftentimes they don't really know what it looks like. But imagine being able to see that as you're about ready to get discharged, and now you know where the pool is or something like that. So I think there are real value. There's real value in mixed reality in the future, particularly for therapy, like I said. And I think, I like to. There's another segment that I'm going to sort of classify as personal health technology, like things that are on you or about you. So like
Mhm.
wearables, certainly IoT, diagnostic devices for home patient monitoring, and I love this notion of digital twin. So just those
Mm.
things about how it really sort of characterizes you as an individual, monitors you as an individual. I think that's going to be it's got to be the way of the future for us. I mean, as we talk about primary care and population management, I've got this ring that tells me that I'm, geez, I snore at night and I've got sleep apnea, and you know, I know I don't believe my wife. She tells me I snore all the time, and I put this ring on. I'm like, okay, all right, I guess I believe you. So now I got to wear a mask, right? But that's too much information, by the way. So, um,
Or yeah, or she kicks you out, right?
but that kind of, I think, personal healthcare technology is going to be something that I'm willing to look forward to, and I know our clinicians will, because there's just not going to be enough clinicians and social workers and care managers to be able to manage folks' health and viability. And I think that's going to be one way for us to really do that, I think, as a health system. And then I think all of this, to me, can sum up to personalized medicine,
Yeah.
and personalization of care, right? Whether it's an agent who knows you, an AI agent who knows you, and you're engaging with, to the sort of behavioral therapy mixed reality kind of experience, to the things that you're wearing that really monitor you. All of that sort of sums up to, creating medicine and engaged medicine about you. Because again, I think healthcare is personal. It's unique to you. It's private at times, and this is just technology is going to get us there, and that's what folks are hoping for with this these emerging capabilities in the future.
I love that vision, Joel. I love we used to talk about personalized medicine, or when we use those buzzwords, it was a lot about the genome and how all of our DNA and genetics would be mapped, and that we would have almost personalized drugs, right? Personalized medicine that was targeted for us. But what you shared was really about a service model and the sort of the things that surround us, even behavioral health, and infusing that, looking at the whole person and meeting them where they are. So I love that part of the vision.
I mean, I
Um,
think the digital front door idea is a good one. I mean, it's interesting because when you think of a door, it's a door to like a house, like you were saying, right? But in the future, we should do away with this notion of a digital front door, and it's just it's really a capability that's in your hands, right? I mean, you and I talk about this notion of putting Hartford HealthCare in your hands, right?
yeah.
And that would be the day that I think we succeed in really engaging with our patients continuously, is when there's really no longer this notion of a digital front door, but it's this continuous engagement through digital capabilities. So
Yeah, bring down the barriers, right?
yeah, yeah.
Be present for the patient and have the patient feel that they're always connected, really, to their health system and their providers. I love that vision, and I'm so happy you shared it with us. Um, well, I think we probably have time for one more question. So I would say, oh, maybe Liat's coming on. Um, are you giving me the hook, Liat?
Oh, I have to say you have a great final question, just so we end right on time.
Oh gosh,
Uh,
it better not be personal. Barb.
We got enough of that.
I know, I threw that out already. Jeez,
Yeah, I have
let's
some good
cut.
nuggets to tease you with
Oh
now.
gosh,
Um, what do you think? How do you think innovation is going to happen? It's happening so fast, right? I mean, we're how would we even define it in the next 5 to 10 years?
So I would just say this. I think if you don't, if an organization doesn't innovate, they die, right?
Yeah,
So innovation is a must do, and innovation it doesn't only mean you're inventing something new. It could be you're reinventing something, you're mashing something up, you're optimizing something. So those are all, in my mind, innovations. But I think at the end of the day, we have to democratize innovation
yeah.
to our colleagues, and that's really the trick. It's not the chief innovation officer only or their team. It needs to be democratized to everybody, because that's going to create and propel your organization to new heights quickly. So that's what I would say.
Well, thanks so much, Joel. I love seeing all the likes, all the that's terrific from the audience. I really appreciate you, and thank you for sharing your views and expertise with us today. Thank you, Hyro, for allowing us to be in dialogue with our community in the industry, and for doing such amazing work yourselves and focusing on healthcare and infusing AI where it can truly make a difference.
Thank you so much, guys. It's a pleasure and humbled to have you close this day off after all this learning and sending our attendees off with much food for thought. So we're humbled to have you, and let's just see if we missed anything in the chat. Yes, all around we want more fun facts about you, Joel. So remember to give some more
One
TMI.
thing that people learned. Yeah, I know.
He's a great musician, he plays the guitar. He can
Ooh.
cut a rug pretty good too. He won the dance competition for
Yeah.
for
All
Hartford
right.
Health.
That's enough of that. Okay. All right.
Okay, next year I want like 6 TMI facts about you.
Ay, ay,
We're just getting started this year until next year.
ay.
All right. Thank you, friends, so much for
Nice.
joining Hyro's
Thank
Digital Front
you.
Door
Thank you
today,
for having us.
and see you next time.
See ya. Thank you.
Bye.